Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. It is an honor to be a presenter in this International Symposium of Global Physiology 2022. I am Nabil Hajar as a first author from Master of Biomedical Sciences, FMPHN Universitas Gadjah Mada. I would like to present our research with the title is Effect of Gradual Dose Chlorogenic Acid on Cardiac Electricity of Streptozotocin-Induced Hyperglycemic Rats, a study of arrhythmia mechanism. Let me start by introduce the problem first. Diabetes mellitus is well-known global burden disease. In 2018, there was 2% of people with diabetes mellitus in Indonesia. WHO predicts that the number will increase to 10% of people with diabetes in 2030. Diabetes mellitus is a chronic disease that causes vascular injury. This injury could lead to some organ injury like peripheral arterial disease, stroke, or coronary arterial disease. In the heart of diabetic rats, we will be found that hyperglycemia will induce some processes that could lead to cardiac fibrosis and disturbance of intracellular calcium homeostasis. Both of them cause cardiac electricity problem. From literature study, we found that chlorogenic acid, a compound in green coffee and tea, has potential on alleviate cardiac electrical damage from diabetes mellitus complication in heart. So the aim of the study is to determine the effect of CGA to prevent progressivity of electrical changes on cardiac ventricle caused by fibrosis and intracellular calcium homeostasis disturbance, which decrease ventricular arrhythmia risk in DM. In this study, 24 rats divided to control group, DM 6 weeks, DM 8 weeks, and groups of DM with CGA graded doses. Electrocardiography was performed at the beginning and at the end of the treatment. Then we identified the parameters. After animal model sacrifice, we perform RT-PCR of heart left ventricular tissue to get mRNA expression of the genes and see interstitial fibrosis with serious red staining. In this research, we found several interesting stories. First, we found that antioxidant and hypoglycemic is the cardioprotective mechanism of CGA. Blood glucose level before termination shows a decrease compared to first week blood glucose levels in all CGA groups. The result established that CGA mechanism is to inhibit organ DM complication is to reduce blood glucose levels. And in the CGA groups show a trend of higher SOD to mRNA expression than the DM group, although it was not significantly distinct from the other group. This shows that one of the protective mechanisms of CGA is by increasing antioxidant enzyme. Secondly, CGA also protects heart from activation and processes of fibrosis pathway. Fibrosis is one of the events that occurs in diabetic hearts, and CGA has protective effect against cardiac fibrosis. The TGF-beta 1 and alpha SMA mRNA expression was lower than the DM groups. And based on our observation, interstitial fibrosis in DM groups were found clearer than control group, and the fibrosis alleviated by CGA. Fibrosis activation by hyperglycemia state could lead to conduction block in heart, so arrhythmia can occur easily. The story is from intracellular calcium homeostasis disturbance. Ca2a as a protein that regulates calcium input to reticulum sarcoplasma was not influenced by DM and CG. Meanwhile, a protein that regulates calcium output to reticulum sarcoplasma, RYR2, had a higher mRNA expression in CGA groups than the DM group. Another calcium regulatory protein, CMK2, had a lower mRNA expression in CGA groups than the DM group. Disruption of intracellular calcium homeostasis could lead to prolonged action potential in cardiomyocyte. From fibrosis pathway and intracellular calcium homeostasis disturbance, conduction block and prolonged action potential can disrupt cardiac electricity of the heart. It could lead to ventricular arrhythmia. Our electrocardiography examination of hyperglycemic rates, like QRS complex duration, then QTC interval, then PR interval, and heart rate shows lower changes in CGA group compared to the DM group, although there are no significant difference for all the parameters in ECG. So the conclusion is CGA is useful for preventing fibrosis and disruption of intracellular calcium homeostasis. So CGA can reducing the risk of ventricular arrhythmias in diabetes mellitus. This study suggests and supports the further exploration of other arrhythmia mechanism of diabetic heart. That's all of my presentation. Thank you for your great attention. Wassalamualaikum warahmatullahi wabarakatuh.